Welcome, and thanks for joining us. Today, we're going to talk about Medicare Advantage plans from United Healthcare, chosen by more Americans than any other Medicare Advantage plans. A lot of this information can be found in the 2021 Medicare Advantage Clarity Guide. Feel free to page through as we go, or ask your local licensed sales agent for a copy when we're done. If you have questions afterward, ask your United Healthcare licensed sales agent. They can help you understand all your coverage options, so you can enroll in a plan that meets your specific needs. But right now, let's spend a few minutes talking about Medicare Advantage plans from United Healthcare and how they're designed to help you get more for your Medicare dollar so you can live a happier, healthier life. Let's get started. Before you can decide if a Medicare Advantage plan makes sense for you, it's important to understand the basics. Medicare, often called Original Medicare, is a federal government health program that most American citizens qualify for when they turn 65. It helps pay for hospital stays, doctor visits, and outpatient care. And while Medicare provides good medical coverage, it doesn't cover everything. Things like prescription drug coverage, dental, hearing, and vision coverage, fitness programs, and out-of-pocket cost limits are not included with Original Medicare. Luckily, there are two ways to get more coverage. These are explained on page 2 of the Clarity Guide. One option is to add additional coverage to Original Medicare. Medicare supplement plans are offered by private insurance companies to help pay for some of the out-of-pocket costs that Original Medicare doesn't cover. You can also add a Medicare Part D plan to help pay for prescription drugs. The other option is to enroll in a Medicare Advantage plan. With these plans, also offered by private insurance companies, you get all the benefits of Original Medicare and additional benefits, which may include prescription drug coverage, dental, hearing, and vision coverage, fitness programs, and out-of-pocket cost limits, all in one plan. Now, whether you're enrolling in Original Medicare, a Medicare Advantage plan, or a standalone prescription drug plan, there are several clearly defined times for you to sign up. Page 3 of the Clarity Guide has all the details, but here's a quick overview. For most people, the first time you can sign up is called your initial enrollment period. This period is 7 months long and includes the month of your 65th birthday, plus the 3 months before and the 3 months after. During this time, you can enroll in Medicare Part A, Medicare Part B, or both. You can also decide to enroll in a Medicare Advantage plan, Part C, with or without prescription drug coverage, Part D, or you can choose a standalone prescription drug plan. Although you're not required to enroll in Part D, there is a penalty of 1% of the average monthly premium for each month you delay your enrollment. After your initial enrollment period, each year you'll have an annual enrollment period, starting on October 15th and ending on December 7th, when you can add, drop, or switch your Medicare coverage. If you choose to enroll in a Medicare Advantage plan, you'll be able to take advantage of the Medicare Open Enrollment Period, which lasts from January 1st through March 31st, during which time you can disenroll from your current plan and make one switch to a different Medicare Advantage plan, or go back to Original Medicare. And if you experience certain life circumstances, there is a special enrollment period, which lets you change your Medicare coverage outside of the initial enrollment or annual enrollment timeframes. Talk to your agent to learn more about qualifying for a special enrollment period. Again, you can find more information about Medicare eligibility and enrollment on pages 2 and 3 of your Clarity Guide. Now that we've covered the basics, it's time to go into more detail about Medicare Advantage plans. There are 24 million Americans enrolled in a Medicare Advantage plan, and 93% of those members say they're satisfied with their plan. Medicare Advantage plans offer many ways to save. On average, members spent 25% less on health care than those enrolled in Original Medicare. As you think about whether a Medicare Advantage plan is right for you, here are 3 more things to keep in mind. First, you must continue to pay your Part B premium. Medicare then gives your premium to your United Healthcare Medicare Advantage plan to help pay for your additional coverage. Second, by law, all Medicare Advantage plans offer the same protections as Original Medicare. So if you choose a Medicare Advantage plan, you won't miss out on anything included in Medicare. And third, Medicare Advantage plans include a built-in safety net. Every plan has an out-of-pocket maximum, which is the most you'll ever be charged in a given year for your covered medical expenses. If you'd like more detailed information about the nuts and bolts of Medicare Advantage plans, please see pages 4 and 5 of the Clarity Guide. One of the most attractive benefits of Medicare Advantage is that most plans include prescription drug coverage. As a reminder, Original Medicare doesn't include prescription drug coverage, and for many people, prescriptions make up a big percentage of their medical costs. To choose the plan that's best for you, it's a good idea to understand how the drug payment stages work and what portion of your prescriptions you'll be responsible to pay. Your out-of-pocket costs will vary depending on which drug payment stage you're in. The first stage is the annual deductible stage, where you pay 100% of your drug costs until you reach the plan deductible. Some plans have no annual deductible, in which case this stage does not apply. Next is the initial coverage stage, during which your plan pays most of the cost and you pay a small copay or coinsurance. The amount varies by plan and depends on the drug being prescribed. You'll remain in this stage until your total drug costs reach $4,130. The third stage is the coverage gap, though it is sometimes referred to as the donut hole. During this period, you pay 25% of your drug costs until your total out-of-pocket costs reach $6,550. The last stage is called the catastrophic coverage stage, during which you pay only a small copay or coinsurance amount through the end of the year. For generic drugs, this amount is $3.70. For other drugs, you'll pay $9.20, or 5% of the total cost, whichever is greater. As you compare different plans, it's important to understand the difference between total drug costs and out-of-pocket costs. Total drug costs include everything you pay for prescription drugs each year, plus what your plan pays. This amount does not include your monthly plan premium. Out-of-pocket costs are the total amount you pay for prescription drugs, including your deductible and any payments by drug manufacturers while you are in the coverage gap. This amount also does not include your monthly plan premium. You'll also notice that most drug plans use what's called a tiered formulary to group covered drugs according to cost. Most common prescriptions are either in Tier 1 or Tier 2, which are the lowest cost prescription drug tiers. If you're looking for more detailed information about the drug payment stages, as well as a glossary of key terms, read through pages 6 and 7 of the Clarity Guide. When it comes to Medicare, one size does not fit all. That's why UnitedHealthcare offers a wide range of plans, including some specialized Medicare Advantage plans designed for specific groups of people. For example, if you are on both Medicare and Medicaid, you may qualify for a dual special needs plan. These plans combine your Medicare and Medicaid benefits and often include prescription drug coverage, dental coverage, vision coverage, and more, all for a $0 monthly premium. Or you may qualify for a chronic special needs plan, which can help you manage chronic health conditions like diabetes, cardiovascular disease, or chronic heart failure by providing added convenience and more affordable access to care. And new this year, UnitedHealthcare is proud to introduce Medicare Advantage plans designed with military veterans in mind, with benefits that complement your VA or TRICARE for Life coverage. If you have questions about these plans or any Medicare Advantage plans, your UnitedHealthcare licensed sales agent is ready to help. They can look up your doctors, hospitals, specialists, and clinics to make sure they're part of the large UnitedHealthcare provider network. They can check your prescription medications to make sure they're included in a plan's drug list so you can anticipate your costs before you sign up. And they can help you enroll in the Medicare coverage that best fits your needs to help you live a happier, healthier life. Thanks for your time today. Now that you know more about your Medicare coverage options, we hope you'll take the next step so you can take advantage of everything that a Medicare Advantage plan from UnitedHealthcare has to offer.